If you're over 60 and find yourself waking up once, twice, maybe even 3 times a night just to use the bathroom, you're not alone. In fact, studies show that more than 2/3 of older adults experience this problem. For some, it's just a mild annoyance. For others, it's a major interruption to restful sleep, and a source of growing concern. So today we're diving into a question I get almost every week in my clinic. Is it normal to pee this much at night after 60? Or could it be something serious? Speech balloon, a real patient story. Let me introduce you to Mr. Ahmed. He's 67, generally healthy and quite active. But over the last year he noticed something. Every night, around 2 a.m. he'd wake up, not from a dream, not from noise, but from an urge to urinate. Then again around 4:30. At first he brushed it off. "I guess this is just what happens when you get older," he said. But eventually, it started affecting his sleep. He felt more tired during the day, less focused, and even a little irritable. His wife noticed. So he came in for a visit, and what we discovered might surprise you. Brain, why does this happen after 60? Let's start with the basics. As we age, a few natural changes in the body can affect how, and when, we produce urine. Bladder capacity shrinks. You simply can't hold as much as before. You produce less vasopressin. This hormone helps your body retain fluid during sleep. Less of it means more urine is made overnight. Light sleep becomes more common. You're more likely to wake up from minor signals, including a partially full bladder. So yes, in many cases nighttime urination is a normal part of aging. But that doesn't mean it should be ignored. Throughout this video we'll explore. White heavy checkmark, what's considered normal nighttime urination after 60. Warning, what symptoms could mean something more serious. Syringe, the medical conditions your doctor checks for. Person in bed and what you can actually do to reduce those nighttime trips, naturally and medically. And most importantly, we'll help you understand your body better, so you can sleep with confidence. This video is for you if you're waking up more than once a night to pee. You feel tired or unrest during the day. You've started worrying about prostate issues, diabetes, or bladder cancer. Or you just want to take better care of your health after 60. Stop sign before we continue. One warning sign. If you ever notice pain, burning, blood in the urine, or sudden changes in frequency, stop watching and speak with a doctor right away. These symptoms should never be ignored, no matter your age. So, is nighttime urination always a problem? Not necessarily. But knowing the difference between normal aging and warning signs is key. In the next section we'll talk about what's completely normal, even healthy, and when you can relax. But first, here's a visual summary of what we've just discussed. Let's take a deep breath for a moment. Not every trip to the bathroom at night is cause for concern. In fact, in many cases it's perfectly normal, even expected, as we age. So let's talk about what's considered within the normal range of nighttime urination for people over 60. Small blue diamond, how many times is normal? In healthy adults over 60. 1 to 2 trips per night to urinate is considered normal. Especially if you've had fluids late in the evening, like tea, water, or even soup. It's called Nocturia, and up to 70% of older adults experience it regularly. But if it's more than twice a night, especially if it happens consistently, it could be a signal that something else is going on. Small blue diamond, normal triggers that don't require a doctor visit. Here are some common and harmless reasons you might wake up at night to urinate. White heavy checkmark, drinking fluids within 2 hours of bedtime. White heavy checkmark, certain medications, especially blood pressure meds like diuretics. White heavy checkmark, mild anxiety or stress, which can stimulate your bladder. White heavy checkmark, light sleep stages that make you more aware of bladder signals. White heavy checkmark, a cold bedroom. Yes, that really can trigger urination reflexes. If these apply to you, good news. Simple changes can make a big difference. Older adult, old woman, real life example. Ms. Linda. Take Ms. Linda, age 72. She came to me worried that something was wrong with her bladder. But when we reviewed her habits, we noticed. She drank 2 mugs of chamomile tea at 9 p.m. She took a water pill at dinner. And she often worried about her grandchildren before bed. With just a few lifestyle adjustments, her nightly bathroom visits dropped from 3 to just 1. Blue Book Quick Fact: How your kidneys change with age. Here's something most people don't know. As we age, our kidneys become slightly less efficient, especially at concentrating urine overnight. This means your body may make more diluted urine during sleep, making your bladder fill faster. So again, for many seniors, this is part of normal aging, not illness. Counterclockwise arrows button: how to know when to monitor versus worry. When you don't need to worry. No pain. No urgency during the day. No blood in the urine. No difficulty starting or stopping your stream. In these cases, your nighttime urination is likely benign and manageable. Key tips to reduce normal nighttime urination. Try these simple lifestyle changes first. Alarm clock: stop drinking fluids 2 hours before bed. Hot beverage: avoid caffeine and alcohol in the evening. Person in bed: elevate your legs in the evening to reduce fluid pooling. Man in lotus position: practice relaxation techniques to sleep more deeply. These steps alone can often reduce the need to wake up and pee. So what have we learned? Backhand index pointing right: some nighttime urination is totally normal after 60. Backhand index pointing right: lifestyle factors like hydration, medications, and sleep habits play a big role. Backhand index pointing right, and with a few adjustments, many people see real improvement. But what if these changes don't help, or the symptoms get worse? In Part 3, we'll explore the early warning signs that your body might be sending. Signs that could mean something more serious is going on. While many nighttime bathroom trips are harmless, some could be your body's way of warning you. As a doctor, I tell my patients, if your body whispers, don't wait until it screams. Let's look at the signs that say, this isn't just aging. It's time to dig deeper. Triangular flag 1. You wake up 3-4+ times every night. Needing to urinate more than twice a night, consistently, is a red flag. Especially if it's affecting your sleep quality, causing fatigue, or leading to daytime naps. This could indicate an overactive bladder, prostate enlargement, poorly controlled diabetes, or even early signs of heart or kidney trouble. Triangular flag 2. You struggle to fall back asleep after urinating. If you're awake for 30 to 60 minutes after each bathroom trip, it's not just your bladder. It might be your nervous system or hormonal balance out of sync. This is common in undiagnosed sleep apnea, which can cause your brain to wake you repeatedly, often triggering the need to urinate. Triangular flag 3. You have a sudden, urgent need to go. If the urge to pee wakes you suddenly and feels intense, that's not typical aging. Could signal an overactive bladder, bladder infection (UTI), or bladder irritation from conditions like interstitial cystitis. And for men, that urgency could be related to BPH, benign prostatic hyperplasia, especially if the stream is weak or slow. Triangular flag 4. You notice blood in your urine. This is never normal. Even if it happens just once, get it checked immediately. Blood could mean a urinary tract infection, kidney stones, or, in rare cases, bladder or kidney cancer. Don't delay. Blood in the urine requires a visit to your urologist, no exceptions. Triangular flag 5. You also experience daytime problems. Does any of this sound familiar? Frequent daytime urination, difficulty holding your urine, a weak or interrupted stream, dribbling after urination, or pain while urinating. If nighttime urination is just one part of the puzzle, it's time to look at the full picture. Something more may be going on. Bearded person, light skin tone, medical symbol, patient story, Mr. Harris. Mr. Harris, 68, came in complaining about 4 nightly trips to the bathroom. He thought it was just old age, until we ran tests and discovered a slightly enlarged prostate, early-stage diabetes, and mild sleep apnea. With simple medications, dietary changes, and a CPAP machine, he went from 4 bathroom trips to just 1, and said he felt 15 years younger. Pushpin, when to see a doctor. Here's a quick checklist. White heavy checkmark, more than 2 nightly bathroom visits. White heavy checkmark, waking up tired, groggy, or anxious. White heavy checkmark, urgency, blood, or pain during urination. White heavy checkmark, any new or worsening bladder symptoms. These are your signals to get help. Not because you're sick, but because your body needs balance. Nighttime urination isn't always harmless. Sometimes it's your heart, kidneys, prostate, or even your brain telling you something's off. The good news? Early detection and small changes can restore sleep and protect your long-term health. Let's now dive deeper into the underlying medical conditions that often trigger nighttime urination, especially for those over 60. It's not just getting old. There are specific diagnosable and treatable issues behind those frequent nighttime trips. Stethoscope 1. Benign prostatic hyperplasia, BPH. Enlarged prostate. BPH is one of the most common causes of nighttime urination in older men. The prostate wraps around the urethra. As it enlarges, it presses on the urinary tract, making it harder to empty the bladder completely. So what happens? You lie down. The little bit of leftover urine triggers your bladder, and you wake up needing to go again. Symptoms often include a weak or slow stream, dribbling after urination, a feeling like you didn't fully empty your bladder, more frequent night trips. Test tube PSA blood tests and a digital rectal exam (DRE) can help diagnose BPH early. Stethoscope 2. Overactive bladder, OAB. OAB happens when your bladder muscles contract before you're ready to go. It sends false alarms to your brain, day and night. It's more common in women after menopause due to hormonal changes, but men can get it too. Symptoms include sudden, intense urges to urinate, going more than 8 times a day or 2+ times a night, leaks or accidents before reaching the toilet. Thankfully, OAB can often be managed with bladder training, pelvic exercises, and medications. Stethoscope 3. Diabetes and prediabetes. If your blood sugar is poorly controlled, your kidneys try to flush the extra sugar out, and water goes with it. The result? Frequent urination during the day and night. Many seniors don't realize they have prediabetes or type 2 diabetes until this symptom starts disrupting their sleep. Other symptoms to watch for: excessive thirst, fatigue, blurred vision, tingling in hands or feet. A simple HbA1c test can reveal hidden blood sugar issues. Stethoscope 4. Congestive heart failure, CHF. Here's a surprising one. If your heart isn't pumping efficiently, fluid builds up in your legs during the day. When you lie down at night, your body redistributes that fluid, and the kidneys rush to eliminate it. The result? You're running to the bathroom at 2 a.m. Signs of CHF may include swollen ankles or feet, shortness of breath when lying down, fatigue, sudden weight gain. Nighttime urination can actually be one of the first signs of early heart failure. Stethoscope 5. Sleep apnea. This condition causes brief pauses in breathing during sleep. Each time your oxygen drops, your brain briefly wakes you, sometimes with an urge to urinate. Many people don't connect sleep apnea with nighttime urination, but the two are closely linked. Other clues include loud snoring, waking up gasping, morning headaches, excessive daytime sleepiness. If you wake up needing to urinate multiple times but also feel exhausted each day, ask about a sleep study. Stethoscope 6. Urinary tract infections, UTIs, or bladder irritation. Especially common in older women, UTIs can cause nighttime urgency, burning, and pain. In seniors, sometimes the only symptom is frequent urination or confusion. Symptoms might include burning or pain during urination, cloudy or foul-smelling urine, feeling like you always have to go, even right after you just went. Left untreated, UTIs can lead to more serious problems, like kidney infections or sepsis in older adults. Pushpin: why it's important to identify the cause. Here's the truth. The solution depends on the source. If your doctor only treats the symptom, like giving you a diuretic or telling you to stop drinking water, you might still miss the real issue: an undiagnosed chronic condition, or a silent threat to your long-term health. Now that we understand the root causes behind nighttime urination, let's talk about solutions that actually work. Depending on your situation, relief may come from a mix of natural lifestyle changes and targeted medical care. Herb 1. Natural remedies that can help. White heavy checkmark: bladder training. Your bladder is a muscle. Like any muscle, it can be trained. By gradually increasing the time between bathroom visits during the day, you can teach your bladder to hold more and reduce nighttime urgency. Pushpin tip. Start by delaying urination by 5 to 10 minutes, slowly working your way to 3 to 4 hour intervals. White heavy checkmark pelvic floor exercises, Kegels. Kegel exercises help strengthen the muscles that control urination. These are especially helpful for men after prostate issues, and for women after childbirth or menopause. Direct hit practice holding and releasing pelvic muscles for 5 seconds, 3 times a day. White heavy checkmark limit fluids, but smartly. Avoid the common mistake of cutting fluids too early in the day. This can actually cause dehydration and worsen bladder irritation. Instead, hydrate well in the morning and afternoon. Cut back 2 to 3 hours before bedtime. Avoid alcohol and caffeine in the evening. These two substances are natural diuretics and bladder irritants. White heavy checkmark watch salt and sugar intake. High salt can lead to fluid retention, increasing the need to urinate at night when lying down. Similarly, high sugar, especially in diabetics, can increase urine production. Pushpin swap out processed snacks for fresh fruit, unsalted nuts, or Greek yogurt in the evening. White heavy checkmark raise your legs before bed. If you notice swollen ankles or feet during the day, try lying down with your legs elevated for 30 to 60 minutes before bed. This helps redistribute fluid earlier, so your kidneys handle it before you fall asleep. Pill 2. Medical treatments that work. If lifestyle changes aren't enough, medical support can make a huge difference, especially when underlying conditions are at play. Test tube treatment for enlarged prostate, BPH. Common medications. Tamsulosin, Flomax, relaxes the bladder and prostate muscles. Finasteride, Proscar, shrinks the prostate over time. These can significantly reduce nighttime trips to the bathroom for men with BPH. Test tube overactive bladder medications. Oxybutynin, Toltrodine, or Mirabegron. These reduce bladder muscle spasms. Some people also benefit from Botox injections into the bladder wall, a newer solution that can help reduce nighttime urgency. Test tube sleep apnea treatment, CPAP. If sleep apnea is causing nighttime waking and urination, using a CPAP machine to keep airways open may solve both problems. Test tube blood sugar or heart medications. For those with diabetes or heart failure, getting these conditions well controlled often leads to big improvements in sleep and urination patterns. Test tube hormone therapy, postmenopausal women. Low estrogen levels can thin the lining of the bladder and urethra, increasing urgency. Topical estrogen creams or rings can help restore balance. Prohibited warning: don't rely on adult diapers alone. Adult pads or diapers may offer short-term relief, but they're not a treatment. They can lead to skin irritation, infection, and even loss of confidence. Always try to find and treat the root cause, not just the symptom. Memo: when to see a doctor. You should definitely speak to your doctor if you wake up more than twice a night regularly. You have sudden changes in urination habits. There's pain, blood, or leakage. You feel tired or foggy during the day. Your symptoms are affecting your quality of life. Old man, old woman, you deserve restful sleep. Nighttime urination isn't something to be ashamed of, and it's not always a normal part of aging. There are real solutions, both natural and medical, that can restore your sleep, your comfort, and your health. If you've been waking up multiple times a night to urinate, please know this: you are not alone and you are not helpless. Millions of seniors deal with this, but you don't have to accept it as inevitable. The key is to listen to your body, understand the potential causes, and take action that fits your health needs. Glowing Star, here's a quick recap of what we've learned. White heavy checkmark: a little nighttime urination can be normal after age 60. Once per night is common. White heavy checkmark: waking up more than twice regularly may indicate an issue. White heavy checkmark: causes range from prostate issues and diabetes to heart conditions, medications, and even sleep apnea. White heavy checkmark: natural strategies, like reducing fluids in the evening, pelvic exercises, and elevating your legs, can help. White heavy checkmark: if needed, medical treatments are available and effective, from prostate meds to bladder relaxants and CPAP machines. White heavy checkmark: don't ignore new or worsening symptoms, and don't suffer in silence. Bell Doctor's final message: you deserve to rest. Your body heals and regenerates during sleep. When that sleep is disrupted, your health can suffer quietly, affecting your energy, your mood, even your memory. So I urge you, don't just chalk it up to getting older. If you're waking up multiple times to urinate, talk to your doctor. Explore the possibilities. Try the natural strategies. Ask questions. Because better sleep isn't just a dream, it's a decision. If you found this video helpful, please give it a like and share it with someone you care about. And don't forget to subscribe to our channel, Urologist USA Today, for more clear, trustworthy health advice, especially for those over 60. We post new videos every week, always grounded in science, explained with care.